So this is another session for healthcare economics. And here basically, last time I had gone over a handout of the formula sheet for the exam. So if you didn't attend that session, it's recorded and I would recommend it. But we really didn't go over an example, whereas here they do. Let's start from the top. I recommend that you write what we do, because I think it helps you remember better that way. And at any point where you have comments or questions, feel free to jump in. So here it says that there's two people whose income is the same, 125,000, and basically they could face a heart attack and incur a cost of treatment of $96,000. Okay, and each has the same utility function, which is equal to the square root of their income. And notice that in this case, we have a square root for utility, which just means that they're risk averse. Okay, we don't need to know exactly why. Just recognize that if they could avoid risk, they'll try and avoid risk, even if they have to give up some income in order to avoid the risk and being safer by not incurring the loss if they get a heart attack. It says Helen faces a higher risk at 75%, and Laura faces a lower risk at 25%. So let's look at letter A. Okay, so then it says what is the expected utility for Laura in the absence of health insurance. So let's go over that expected utility. And ideally, I would want to have Laura as a subscript. Okay, and then we'd have the expected utility of Laura. I think she could have a heart attack, right, with 75%. And then if she does, then it'll be the 0.75 times the square root of an income of $125,000 minus the loss that she would incur for the treatment. So minus 96,000, okay? Plus 0.25% chance, so 25% chance, I should say, that she's healthy. And in the case that she doesn't have a heart attack, she incurs no loss. And if you can compute that, I'll do the same. Basically, I get 216.11, rounded to 2 decimal places. So basically, that's her expected utility without health insurance. So basically, she'd have to incur the whole loss, okay? Now let's look at part B. It's asking for the expected utility of Helen without health insurance. So we'll look at that also. And Helen, I believe, was different. Let me see, did I get these probabilities right? No, I didn't. Okay. No, don't worry, I have it. I mean, if you have an answer key, I can get it, and then if others don't have it. But I mean, here it's just I mix the probabilities. Let me be more organized and say Laura can have a heart attack with probability, because I wasn't looking at the sheet, with probability of 0.75. Okay, and then Helen. You see I'm mixing them up. And then Helen, I think, was the same, but with 0.75. Okay, so then Laura, it's just I mixed up these. So then that would be 0.25 chance that she had the heart attack, and 0.75 chance that she is healthy. Okay, so you got 307.7. Okay, perfect. So let's do it for Helen. Helen was 0.75. I realized it afterwards here. Helen 0.75, and then 0.25 chance that she's healthy. So what would be the expected utility for Helen? So that's 0.75. Actually, that would be the one I just found, which was 216.11. All right. So now, I mean, that would make sense that Laura's is higher since she has a smaller probability of having a heart attack. And then part C says, what would be the actuarially fair premium for Laura? Would she buy the health insurance plan if it was offered at the actuarially fair premium? Provide a brief explanation. Okay, so the fair premium. Okay, so the fair premium for Laura would be equal to the expected payout. Yep, I could explain it. So that would equal the expected payout from the insurance point of view. So from the insurance's point of view, they're saying Laura has a probability of getting a heart attack equal to 25%. So there's a 25% chance that I'll have to pay Laura, if she's one of our insured customers, $96,000. Whereas there's a 75% chance that she doesn't get sick and I will not have to pay her anything. But on average, meaning you can think of this as playing a game multiple times. I don't want to call it a game, but meaning there's probability attached, so outcomes are uncertain. So that's what I refer to when I say it's a game. So when we refer to payout, it has nothing to do with utility. It's only about the money that's going to be paid out in the case of an accident. And of course, then we'd have to find the expected payout since the outcome is uncertain. So then in this case, they're expected to pay her $24,000 in that regard. Does that make sense? That would be the fair premium. So are we good up to that point? And I think last time we discussed that an insurance company that's profitable will not charge $24,000. Because if my expected expenses are $24,000, then I want to charge more than that in order to make a profit and cover administrative fees as well as taxes. Okay, and then they ask if she was charged a fair premium of $24,000, would she accept the health insurance? Well, I kind of gave you a hint that these agents are risk averse based on their utility functions. So, you know, the fair premium is the best price that the insurance company could give them, right? So, I mean, you know, I don't see a reason why they wouldn't take it. But to give a more objective explanation, well, the idea being is because when the utilities are square roots, they're risk averse, which means they want to avoid risk. But let me try and think of a better explanation. Okay, so let's do it. How about let's find expected utility for Laura with health insurance. Exactly. That's all you have to know. That square roots are risk averse. So expected utility for Laura with health insurance at the fair premium price. I mean, I kind of gave you a rough idea, you know, off the bat. In the case of if you're running out of time. Exactly, but now we have to take into account the premium. Insurance premiums are interesting because premiums are basically, it's almost like, how should I say it? We're paying the premium to pass on the risk to someone else. But so notice that if I pay my insurance for a full year and I didn't get into an accident then, basically it's almost as if I didn't get any service, right? I didn't get any tangible benefit, any service for it. But we did get a service in the sense that we were covered. So we pass on the risk to someone else. So let's see how that would play out. There's a 75% chance that Laura gets sick. So in this case, I'll abbreviate. In this case, her expected utility would be 0.75 times 100 times the square root of 125,000 minus, but then in this case, so she'll get sick. Maybe I should explain it like this. She'll get sick, so she'll make a loss of 96,000. Whether we get sick or not, we're having to pay the insurance premiums, and that's basically why I say that they're interesting, because basically then someone would ask, well, what am I paying for it in the first place? And the reason for that is because we're passing on the risk to someone else. And why are we passing on the risk to someone else? Because we're risk averse. That's basically the premise behind it. I mean, in the auto insurance market, it's not because we're risk averse necessarily, but rather because we're forced to buy car insurance. Okay. But then that gets into a different reason that people may overestimate their good, safe driving skills and not buy insurance if giving the option and stuff. Okay, so in the case that she gets sick, she'll make a loss of $96,000, but then the insurance company will reimburse her, and that's the key. But she's going to have to pay her premium of $24,000. So basically what I'm saying is that this never comes into play because the company will take care of Laura. But in the event that she does not get sick, she would still have to pay the insurance premium.